working on. So it's one of those sessions whereby you get to see what's really happening in the internship, and you're not just hearing from the sales team, telling you this is how we do it, this is what we do. Everything is just audio. It's in this session you get to see everything in real life, and you also get to ask questions directly to the intern or interns, depending on the number of people that will be presenting. Okay, so it promises to be a very interesting session, and I want you to start now to start keeping your questions ahead of time, because it's only once in a week you get to see our interns present like this. All right. So if you're new to Amdari, if this is your first time, or maybe you've attended a couple of our sessions before, but you've been looking forward to this one, I'm going to tell you that you should just take your time, listen to everything we have for you, and when it's time for questions, please do well to ask as many questions as you would love to ask. All right. So today's project showcase is on a particular career path, a very interesting one, my favorite, and that's data analytics. Okay, so if you're interested in data analytics, it's one of those sessions you'd want to really pay attention to. But if you're in any other career paths in tech, like maybe business analysis, project management, and all the other career paths, don't run away, please. You would still be able to benefit from this session. Okay, so just stay put and um just listen to what we have for you. Okay, so if you're excited for today's session, just give me a thumbs up, or you just give me an emoji. I want to be sure that everyone here is awake and listening. All right, James, thank you. Tosin, thank you. Great, 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 great. All right, let me see if any other person has introduced themselves before I go ahead. Okay, I don't think we have a couple of more introductions. More people are joining. If you're joining me, please let me know your name, career path, and what you're interested in the chat, so that we get to connect on a better level. Okay, so if this is your first time, with Amdari, I'm just going to give you a very, very concise summary about what Amdari is all about, right? So you're trying to get into tech, and you've done a couple of courses. You're now, you're looking for a job in tech for a number of reasons. People come into tech for so many reasons. Maybe you want to start working remotely, you want to start earning better, you're tired of care jobs, you're tired of jobs that aren't fulfilling, but you're trying to get a job in tech. You notice something peculiar in the tech job market. You notice that it's not easy to get into, and experience is very, very important. But the crazy thing about this experience is that these industries, these hiring managers, they're not ready to hire you to gain that experience, especially if it's your first time coming into the industry. So how exactly are you supposed to gain this experience if they are not ready to give it to you? That's where Amdari comes in. Why do they even think experience is important? It's because they want to be sure that you can do the job. Already, African countries are already very underestimated. So imagine coming from Nigeria, and they would expect that you really don't know how the UK work market job market works, or you don't really know, like, there's just a lot of assumptions around it. So they want to be sure that you have actual experience, and Amdari has created such an environment whereby you get the kind of experience you need in a very low risk environment, right? So you get to work on projects. We are also preparing you for the job market. And if you fall into any of these career paths, data analytics, data science, data engineering, just give it a thumbs up. If you fall into any of them, DA, DS, DE, BA, SOC, ethical hacking, GRC, PM, please give me a thumbs up. Let me see if you're in the right place. I'm just going to quickly check if people are okay. Frontman, great. Right, great. All right, you guys are in the right place. I'm going to tell that for a fact. Okay, good, good, good. More people have introduced themselves. Arthur, interested in data engineering. Welcome. Tosin, interested. Okay, data analyst consultant. That's our person. Great. Bright from Manchester. It's a pleasure to have everyone on the call. So this is literally what we do for you at Amdari, and I'm going to go more in depth right after the presentation from our consultants today. That's back there. I hope I got that right. Oh, Aminat, I'll just call you Aminat, please. I don't want to.
That's fine. Or Titi. Yeah.
Yes. So who exactly is speaking to you? Who is Victory and how can she help you? All right. So I'm a data-driven growth strategist and I'm also a career coach. Now, at some point during this session, you're going to have questions. Maybe you've been trying to break into the industry, you have questions, you're trying to gain clarity onto the next step. I'm that person that would give you that kind of clarity. So you get to have this session with me for free for absolutely nothing, right? You can ask your questions, you could get clarity from me on this call as we proceed. That's exactly how I help you. So I've literally spoken to at least 1,000 people for the last couple of years, and I've helped them navigate their way into the tech job market. So if you have questions, if you need clarity, you can as well, take advantage of me being on this call with you today. All right. So that's just a little bit about me and how I can help you. Now we have Efemena Epro, and he is the co-founder of Amdari. Now we have the likes of Efemena with so many years of experience, at least half a decade years of experience in the tech job market, and he has also helped at least 2,500 um, tech enthusiasts transition into the industry and even land their first jobs without prior tech background. Do you understand? So he has that wealth of experience, and these are the likes of people you would have in your mentorship sessions. So Ephemeral is one of those kinds of people that you'll be able to get real insights from, you know, because he's already in the industry, he has had experience and all of that, right? Now, why are you in this session? If you're here today and let's say you've never been in any of our meetings before, it's not by mistake. You're not here in Andari by mistake. You're here for a couple of reasons. You're trying to get a job and you figured out how hard it is to get a job in the job market. You need experience, all right? So experience is the only way that these guys would be able to hire you. Amdari helps you to get that experience. Let's say you're an entry level graduate, you're trying to get a job right after masters and you're finding it hard. We support you. Or if you're a mid-level career professional, you're feeling overwhelmed by the industry, you're trying to transition and you're finding it hard, we support you with that. Okay. Or let's say you're an immigrant, you're coming from Ghana and you're trying to get a job. You've seen how hard it is. You've seen that care jobs are not as easy as, I mean, it's not easy. Everyone is trying to get something meaningful these days. So tech is one of those career paths that gives you that fulfillment. So if you're now trying to transition and you're finding it hard, Amdari gives you the kind of experience that would help you seamlessly get into the industry. Now, if you find yourself in any of these shoes, I can tell you that you are in the right place. So, why are we here today? We are here for Amdari, we are here for my consultant, Aminat, and she has a very interesting healthcare project for us. So if this is your first time joining us, you have the pleasure of meeting her and listening to what she has for us today. So Aminat rather, are you ready for us? Just let me know if you're ready
Yes,
for
I
us.
am. Yes, I am.
Thank you so much. So I'm going to stop presenting now and I'm going to give the floor to you. I want you to go ahead with what you have for us,
Thank
and
you.
I'll come back up once you're done to wrap up the session. Okay.
No problem. Thank you. Let me share my screen. Okay. Can you see my screen?
Yes, it's coming up. We can see your screen.
Okay. Thank you so much. Okay. Okay. Hi everyone. Good evening. Good afternoon. My name is Aminat Bakari. I am representing the June cohort. I'm here to present to you guys about a project that was given to us to work on, the leveraging social determinants of health analytics. That is, we're trying to address healthcare disparities, and our focus is Gambia. So I was given this project just because Gambia is an area of interest, and we all know Gambia is a country in West Africa, and our very main focus is a particular set of region. Like there's 7 regions in Gambia, and they have a lot of, as you all know how Africa is, we have a lot of underserved communities. So they've been battling this health crisis for a long time. And we came in and I was given this role to play. So okay, give me 1 second. So we know, according to statistics, Gambia is said to be like at least 86% poor. They are really poor people and they have really poor health centers, facilities, and we realize that they have a lot of inconsistencies. So I was handed over the data to work on, and I realized that they have a lot of isolated data sets within their organization, meaning that their data is in silos. It cannot be accessed, they cannot be stored easily, they cannot, at the end of the day, stakeholders can make decisions. So how do I come in as a data analyst? I make sure to get all the data they have. But can you imagine walking into a hospital and the doctor start writing, on paper for you, diagnoses on paper, everything on paper, and at the end of the day, you cannot gather anything. There's no information to collate. Information is either lost and it cannot be integrated. So, and this can cause a lot of havoc in the health system. It lowers quality care. It reduces patient engagement, especially for chronic diseases or disease breakout. So I got this data and I decided to work on it. So I'm starting with healthcare analytics. This is what we do. We give solutions to disparities. We help companies, take care of their data system, making sure that resources are allocated effectively. So this is how we say it, focusing on identifying these healthcare gaps so that enough resources can be given to regions that will benefit from it. So moving on to how we see our businesses, we see that there's a lot of fragmented data everywhere, data flowing here and there. There's no standardized form of data. There's usually manual data processed. Let me put it on reading form. Okay. Manual data processing, they are usually delayed. There's a lack of real-time insights, missing just partial context. So data is never sufficient, information is never sufficient. So there's no way people will be taken care of. So we kind of look into what could have been the problem. So I decided to see that there are factors that are actually hindering all these things. So could it be that they don't have good technology? Could it be that they are really, really poor, or they live in mostly rural areas? So we can dive into that after we get our data. So I got the data in raw Excel data sheet, and there were 4 files. I got the social data, I got the demographic data, the healthcare data, and the Gambia region data. And these raw data, they were stored like I mentioned, I got them in Excel form, but I needed them to be integrated into a whole file. And after I got them in the file, I used get data to transform into Power Query. And with the use of Power Query, I was able to merge all 4 files into one whole spreadsheet file. And after doing that, I opened online Excel, then transferred this file onto, I make sure to actually save it on OneDrive, because OneDrive is, as we all know, is cloud-based. So I transferred them onto online Excel and I saved it in there so that, data can be accessed. If it's online, it can be reachable. And after doing that, I intended to go further by automation. And automation is a very good way of synchronizing your data. It makes all your data into one place so that people out there can reach them. So, and this is where Power BI comes in handy. So I created I made use of Power BI. I created my account and transferred into Power BI, but I didn't load them immediately because I needed to be sure that my data was clean. So I made use of Power Query in Power BI to clean my data. I changed my type, went into the data columns, made sure that all my types are correct. The one that has the character, the text, the integers, I made sure they were intact. Then I removed empty spaces, empty rows. The top row, there was nothing in there, so they were double duplicated. So I took out one. I replaced values. I removed columns that were not important for use. Then, most importantly, duplicates. We need to make sure that our data is not duplicated so that it doesn't affect our insight. So after I did that, I merged my data all together and I opened new measures before I transloaded, and I transloaded the data finally. So my data being on Power BI, this is hold on one second. So this is how, after I transferred my data, I started with my measures. I made sure to have my average age, just to get my KPIs, average age, my percentage of male, females, all my demographics, because I needed two dashboards. One is the demographic and demographic overview, and the other one was the SDOH, which talks about the health factor overview. So I made sure to create my percentage female, admission rate, because I needed all those ones. Admission rate, age being, I created this, then the readmission rate, just for us to know how much or how many people are being admitted at a particular time. So this is the first information, the first KPI metrics we had, and we see here it's population 5,000, region 7, age male and female. But going back to that, it didn't finish. I needed to, automate this information while creating my insights. Because after you create your insight, you will go back to make sure you publish into Power BI service. Power BI service is a cloud-based service which encourages online automation. It refreshes your data so that when they are synchronized and they're integrated, people can, anybody can gain access to it. Data cannot be deleted. It cannot be, trashed. There's accuracy with with online automation. So this helps in syncing the new Google spreadsheets that I had, which is the Excel sheet, with the dashboard, notifying our stakeholders in real time. So when the stakeholders see it, anything you input in this data, the stakeholders will surely see it. It gives a report, a message onto it. There's Another way of automation, which is creating the form, and this is on Microsoft too, it's a way of data collection, because without doing that, there's no way you can get information. So I created the forms, and this is the data collection. Created the form. It's needed because with the form, it works with the Power Automate. So when you now, let me show you. This is an example. Give me 1 second. This is an example of the forms. This is a Gambia region form. We have the ID, the region. So information is gathered through here, and it is automatically transferred onto Power Automate, which triggers Power BI service. This is our Power BI service. So this is the demographic overview, and this is the social determinants of health overview. So we're having to, so after creating that, because from the workspace, you also have the semantic where you refresh every time, you add in information, and automatically, as I did that, I was able to record like 10 different forms, which increased, like I showed you earlier, it was 5,000. Now I have here 5,010 population. So you can see that it's showing in real time. It's showing in real time. So this has really, helped with check and balancing, early access to diagnosis, quick intervention to healthcare delivery. So moving on, this is what Power Automate is best for: faster decision making. It helps to improve data accessibility. It enhances public health planning, and it reduces disparity in targeted regions. So every region will be checked, will be ensured that there is no loophole, there's no gap, nobody is being left out. So this is the insights we got from this is the Power BI desktop. So here we realize that we are dealing with population of 5,010. That is after we got our responses from the people. 5,010, region 7, average age 46. The male percentage we're dealing with is 49.5, female 50.5. So, and we are looking into 4 different chronic diseases: malaria, HIV, diabetes, and tuberculosis. So we see with our insights and the DAX measures we created, we are able to gather from it that malaria is the most prevalent disease, in these regions. And it happens mostly with the rural settlers. And we have tuberculosis too, which is the lowest, and this is the prevalent diseases. We have HIV, and this is diabetes, but obviously they are battling more with malaria. So here it says income level by population. People who gain, they make money moderately. They are more in numbers than the low and the high income earners. And health literacy, it shows that a lot of people are, they don't have knowledge about their health. They don't have knowledge about hospitals, care, admissions. They don't have any clue about, receiving quality health. So this is where, I came in, just to get more information and be able to, in real time, make sure that this data is being projected to our stakeholders so that resources can be well allocated to all these regions. So this is the admission rate. It shows that in all these regions, Basse is the highest, affected by admission. They are mostly affected by admission rates in the hospital with 65. Every other region too is more than 50%. So it doesn't still make it good. So this is the lowest, and here transport access says that the poor transport access is the most. That means they don't have good roads. The area is not accessible. So they are worse than the urban, obviously. So this is the demographic overview. It talks about the people, the age status, the education status. Then we now move over to the social determinants. These are the factors, the main social factors and structure that contributes to admission and care rate, care visits. So these are the determinants. As I check, education status is shown with the chronic diseases category. That's primary education status. They are mostly affected. Is it that they don't have enough education, or they are not just taught about all this, how to go about these things? So the employment status shows that employed people are mostly affected. Ethnicity shows that Madinka region is mostly affected. Age category, it shows that the adults, the adults are mostly affected. And maybe because they are older, probably because they cannot move out of the regions because of their age. And gender, it says that the female gender is mostly affected. And health literacy states that people with really low, like we said earlier, people with low health literacy, they don't have idea or clue, they are not taught. Nobody to help them with how they can go about their health. They are mostly affected. Transport-wise, transportation is not good, it's poor. Income level, people with moderate, they are moderate, just like we saw earlier. Then the regions, these are the regions that are affected, and we see here that Jajambure is mostly affected. Housing stability, malaria still tops, but here we see that in all these chronic disease category, that's stable housing stability, they are mostly affected. So we really don't know why. Maybe they are overcrowded, or they are densely populated. So that is why we have all these insights available. Then here, this is a decomposition tree, and it shows how all these factors, these are non-medical factors, like education, things that contribute to our well-being, education, transport, food, income, how they affect this this admission care and admission rate and care visits. People go to hospitals when they are sick. They are they are admitted and they are being cared for. A care visit is when they are able to see their PCP, which is a primary care physician. But some people are not even able to get that access. So in this region, we see that care visit is admission rate is 62.9%. Doesn't mean that people we have enough information to see that people are really admitted in the hospital. Then the region, it says Basse. Basse has higher percentage here, means that Basse region is mostly affected. Then the transportation, it looks good, but even though the poor ones are and the good one, they are both 50, which is not so good. Income level, it's moderate. Health literacy is really low. They have no clue what's going on. Then the education is 0, is like 100%. They have no education or whatsoever. So how do we still come in? So after going through all this, we realize that a lot is should be done. So that is why it is good to have enough integration of information. Manual process can distort demographic insights in the ways that can affect disease tracking, resource allocation, and health equity. So that is why we would, talk against fragmentation of data across settlements, across hospitals. So how do we come in still? And the recommendation we are giving our stakeholders is, I make sure for them to understand that enough policy needs to be put in place. System environmental changes. There are times that, you know, they need safe houses, they need affordable housing. What is the government doing about that? They need quality education. And we see that we can even offer, you know, the government to give them incentives or medical insurances, like we have the NHS, you know, the Medicaid, the Medicare. We can do that, then subsidize transportation for them, make sure their roads are good, and this gives them easy access to their respective hospitals. Then predictive analytics mode, we need to target where the outbreaks are. Which region is mostly affected? Is it Jajambure? Is it Basse? Is it Masankoko? Wherever they may be, we need to know which one is. So like we said earlier, it was Basse at one point, then the next one is Jajambure. So what is missing in one region and is not in another? Whichever region that is doing well, we can replicate whatever, you know, outcome or, you know, positivity in those areas. We can do that in other areas. So then we automate risk scoring for social vulnerability, like when there's a low percentage in housing, there's a low percentage, probably there's a rise in diseases like outbreaks. Let me say, for example, Ebola, then there has to be, in the automation, there has to be like a trigger that will say, okay, as they do in United Nations, like there's a trigger everywhere. You know, there's something going on here, and this gives real-time insight. This gives real-time, you know, informative occurrences, and we are able to gather our data without manually imputing or writing them down on papers. So there has to be a set of rule-based alerts. When root cause, know what is going on, happen, we go to the grassroots and find out what is going on with these regions and the people. Early deployment of community health workers or launching policy briefs needed. Then we track the outcome. What are we gaining in this area? What is the outcome? How are they, you know, benefiting from these resources, this care? How do we replicate it to other regions? That is what we are looking into. Then the staff, train staffs in equity, get people ITs, you know, technology, teach them technology, teach them little basics, you know, in imputing data into the system, like data entering, automation, and even the health workers too. They train them to, you know, to center care around these people, and, you know, and look into their culture. How do they share resources? How are their beliefs, how, you know, concerning all these things? And we engage the community stakeholders too. That is the most important. We partner with a lot of like Shell, all these big companies. They do community social works for people, like all these underserved peoples and communities, so they can, you know, do faith-based groups, schools, non-profit groups, and use participatory, make sure they are participating, give them roles to play, town halls to identify lived challenges, what they are going through, make sure they are well educated, launch literacy, health literacy campaigns tailored to local languages. They can do local languages and culture, speak their language, educate them, like this program they do for eradicating malaria initiative, HIV, you know, pop up on ads, then train community workers to bridge gap and trust. And this is, you know, it gives them enablement to be, you know, to make sure that all resources are shared equally among all the regions. And this, everything that we are, you know, we are doing, I make sure that they are being automated. Automation is key. It is really because it correlates with the care and the admission visits in these regions. So I hope I am able to cover as much, and I see that moving forward, we will continue collaboration, automation in real time, and we also must make sure we monitor. Machine language can be introduced too, because it helps in gathering big data like sensors, know their numbers, electronic health records, and all sorts insurance information. So we inculcate machine languages too. So real time, we will be able to, drive measurable impact and close health gaps across all population. Thank you very much.
Thank you so. Oh my God, you guys! I would love for you all to just give Aminat a round of applause. That was a very wonderful presentation. Thank you so much for that presentation, Amina. And if, I mean, let me check the chat if you have questions. It's time for question, guys. So if you want access to the recording from this session, please fill the attendance form. And if you have any questions for her, it's time for you to ask. I'm going to be checking the chat. Even if the question is, or author, I don't know, is this, I don't know what language this is. Is that Igbo? Please, can someone interpret in the chat? Because I'm not sure what language that is, but okay. So does anyone have a question for Amina? Let me see. Even if it's around how the program works, or how long did it take you guys to work on the project, Amina?
It was basically 2 weeks, depending on, how the time given to us by the
Okay.
stakeholders. So yeah.
All right. So overall, how would you say your experience was like working on that project? Um, you know, what can you say generally about your experience working with Amdari and with the project so far? Okay. Let me see the chat. Author said you did well and he was just praising your efforts. Okay.
Oh,
All
thank
right.
you.
Thank you. Yeah. All right.
Okay.
So generally, what can you say about the experience working on this project before you joined, during the program? I mean,
Um, I think before I joined, it was I kind of always wanted to, go into IT because I've had flair for that. But I've been to a whole lot of IT places and I've tested the waters and I struggled back and forth and I think Amdari is different. Is it gave me a different leverage or on doing the real thing, the real life issues. I studied here, I read some books, and I did some practical here and there. But this is where the real life issues are, and I find myself in a whole lot of places. And doing this project has really opened my eyes to continually see that it's not so hard to understand because I delved myself into it. So that's I know, from here it gets better. It's just, me finding myself in this situation. But Amdari has opened the path for me. I must say, to be honest, is no, I'm not joking about it. It really gave me real life issues to solve, and I'm happy I did that.
all right. Thank you so much, Amina. You can stop sharing. You can stop
I
sharing
think
so that
someone okay.
yeah.
Yeah.
So you have a question in the chat. Well done, Amina. If you were given more time, what would you analyze for more insight on this project? That's the question in the chat for you.
Um, maybe I would have, I don't think, every time you keep seeing new insights, like they keep coming. So at one point I'm done, then the next minute I see new things. Like before, 15 minutes before I came back, I still changed my slides. You still keep seeing new insights every day. So there's a lot to change. They keep coming. They keep coming. It's like magic to you. You just see how it flows through you. So I honestly, data is key. That's if I answer your question, but it keeps coming. Let me.
All right. I feel like that was literally the best answer to that question because
Sorry,
even
I'm trying
after this,
to.
if you go back to look at your slides or your analysis and everything, you'll be like, ah, I just want to see more about this aspect. Next thing you find yourself analyzing the data again. So I understand
Yeah.
where you're. Yeah, I think someone's hand was raised. Trying to check. You can raise your hand up so I give you audience. Okay,
About
what's your
to
advice for us
journey.
about to embark on this journey? All right.
Um, I my advice is don't just give up. Like giving up is just thinking that you can't do it. Like just keep pushing. Everybody is there. You get frustrated, to be honest. You get, you almost get to the point of, you want to drop it all, but it's just numbers. It's number. I'm thankful for Emeka. I cannot lie. I have a very good coach, and he pushes. At times it can be annoying when he's
Emeka, are
saying,
you here?
"You people
Take your
are not
powers.
doing. You people are not." But I always
Yeah.
tell myself, like, "Oh no, he wants to push us. He wants to push us. Just keep pushing. Don't give up. Any tool you find yourself doing that you can, don't overburden yourself. Just take it one at a time and keep pushing.
All
Thank you.
right. All right. All right. Okay. Bright says thanks.
You're
Okay.
welcome.
Yeah. Tosin says Emeka is superb. I mean, okay. Does any other person have a question before I go ahead? We still have time with Amina. I can ask her whatever questions you want to ask. Maybe you're interested in the program and you need more information. I mean, you can listen to it from the horse's mouth. It doesn't need to be from my mouth. She's in the program and you can ask her the questions you have. To raise your hand, I'll give you. I think it was Veronica that raised her hand at some point. I'm not sure, but I just saw it for like a second. Okay, so let me just see. I don't think we have any more questions. That was a very good presentation, and I wish you all the best going forward to the program.
Veronica, stay.
I'm here to observe as a PM. Francis, I know you. Don't worry. I know you. He says, "Well done again. I'm here to observe as a PM consultant. I joined in May."
We have two
Francis.
people
Francis,
there.
yeah, it's very wonderful. It's very lovely to have you on the call, Francis. All
Thank
right,
you.
then. All right. So this is okay. What tools did your team use? That's from Sadiq. Sadiq, rather.
Okay. It was Excel, Power BI. So we used Power Query on both Excel and Power BI, then Power BI Desktop, Power BI Service, Power Automate on Microsoft. Yeah.
All right. Thank you so much. Let me see if there are any other questions in the chat.
You're welcome.
Okay, the person says thanks. Thank you. All right, so I'm just going to go ahead from here. If there are any more questions, they will drop it in the chat and I'll be able to attend to it or I'll call you up to answer. So does any other person have a question before? Okay, Ben has a question. Ben, you can unmute yourself. Let me know if you can unmute yourself and you can go ahead ask your question before I proceed. Hi Ben. Use the microphone button. That's the unmute. So you can unmute yourself and ask your question. Okay, I'm not sure. Okay, you can use the chat if you cannot unmute. All right, use the chat and type it in the chat. I'll be able to answer it, or I mean not to be able to answer that question. So I'm just going to go ahead from here. Um, if you're here, you're yet to join the program and you're trying to get in, Diary is the best place for you. You're trying to gain real world experience. You probably worked on a couple of projects and you feel like, so you probably done a couple of training, but you don't still feel confident about starting your career in tech, or if you don't feel confident about landing a job in tech, Diary is here to support that. So how exactly do we help you? You get to work on real life projects, and these projects span across multiple industries. Just like Amina's project today was in the healthcare sector, you'd have projects across different industries. And the reason being that we don't want you to be stuck to just one particular industry. We want you to be a versatile professional. And it's also going to help when you're applying to jobs, so that you're not limiting yourself to just a particular kind of industry. You can also apply to different industries and different job titles. I'm going to give you an example. There are some unconventional job titles that you may not even assume that it's relating to your role, right? You could be a project manager and you see things like um you'd see things like project officer, or you just see PMO, different ways. These are all in the project management ecosystem, and you can literally get in if you have the required skills. But because you've not worked across some of these career paths, you may not really understand how it works. Just like how we have healthcare analysts, sales analysts, you have those are just data analyst roles with different fancy names, right? Because of the industry you're working with. That's why we give you projects across multiple industries, and we expose you to tools that industry standard tools, right? So with Amdari, we're not telling you to come 100% correct. We're telling you that you can come on board, at least have foundational knowledge in the career path you're trying to land a job in, okay, or you're trying to transition into. Have some foundational knowledge, and we'll be able to build it up from there, okay? So even if you've it's very well use Excel and you're still learning Power BI, or you know how to use Google Sheets, you're still trying to learn the other one, you could come work on this project. Would help you to expand the other technical skills you have. And you're 46 projects within the time span that we currently have for the program. Now, what are you getting after this program? You're getting a UK work reference letter. So it doesn't even need to be after the program. While you're in the program, you're working as a data analyst consultant, or you're working as a consultant with Amdari. For those of you that joined earlier, you'd probably have seen some introductions. Some of our interns with pride telling us that they are consultants. You wouldn't hear anything like data enthusiast or data analyst. They're all consultants working with Amdari. So that's also what be on your CV. I'm just curious to know how the GRC project and internships are. Very interesting question. So with time, I'll show you a sample project so you get to understand how it works. Okay. Now you'd be getting a UK based work reference letter, and you can have this up until 2 years after you're done with the program. Okay. Aside from the project based experience, this is you working on this project, you gaining your technical skills. We also make you employable. What does that mean? It means that we care about you getting the job. We don't just want to dump projects on you and leave you behind. No, we make you employable, revamp your CV, optimize your LinkedIn, and also prepare you for interviews. So for those of the interns on the team, on the call, I'm pretty sure you know your employability. Amina, that's literally what she does. So for the new guys, we have an employability specialist in charge of CV revamp, LinkedIn optimization, interview prep. You also have mentorship sessions where you're meeting with people with so much experience in the field. They come here, share their knowledge with you, and also help you navigate the job market you're trying to get into. So these are all things tied down to the program, which you are going to get access to just by virtue of you being an intern with us. The best part about this is that you're not working by yourself. You're working with a team. I would always use myself as an example. I've worked on personal projects, and I know I am not strict to myself on deadlines if I'm working alone. Okay. So there's this thing about working with a group of people. It's called accountability. Someone is there to hold you accountable. You have your team lead, you have your coach, you have your mentor, you have someone you could always run to if you need support, if you need help. All right. So it's not a do it by yourself kind of program. It's a we help you get to where you're going kind of thing. So you're going to get the necessary support that you need if you are trying. Okay, I mean, if you want to go off video, it's also okay
Okay,
because that's
thank you.
fine. Thank you so much. You're welcome. All right. So I just see in the chat, is it a one-on-one mentorship? Okay, so we have group mentorship sessions, but if you still want to have a one-on-one with your coach, or you want to have a kind of conversation with your mentor, your coach, you can also request for that and it's going to be granted. But generally, the sessions are mostly in groups, but you have access to your coach when you need to. So you just request for a session if you want to speak with your coach or your mentor. Is it an individual project or a group project? You're working with a team, so that literally makes it a group project. But each, I think, individually you have deliverables for the project, but you're all coming together to work on it as a group. So when I say group, I'm not saying 20 people or 30 people on a project. No. So you'll be working in teams. I don't like to call it group. Group sounds like it's high school project. You're working in teams with a team of people, okay? And each you have your team lead, you have someone that is also your coach. Your coach is the person that you can run to if you need support with your project, okay? You get to also have stand-up sessions, drop-in sessions, whereby you and your teammates are coming together at a convenient time to talk about where you all are with the project and how to move on from there. Now, for every project we introduce to you, there is what we call training session. And there is not a training organization, but we understand that not everyone are at the same level when it comes to their technical skills. So this two training session helps us to carry everyone along the same pace. So before you start a project, we run you through how to use the tools necessary to accomplish whatever goal for that project is. Okay, so you're going to be having access to all of this as an intern, and this is just to say the least, because the program is well designed to make sure that we are grooming you for the tech job market, and specifically the UK job market, even if we're not limited to location. But if you've been looking for an environment whereby you can make these mistakes, you get corrected, you get to make these mistakes and move on from there and become better at your skill set, Amdari is the right place for you. Okay, so how exactly can you come on board? How exactly do you gain this real world experience? I mentioned certain career paths that we deal with: data analytics, data engineering, data science, business analysis, stock analysis, GRC, ethical hacking, and project management. So someone asked me in this session about GRC, which I'm going to answer as we proceed with the session. But generally, all these projects have the same method of operation, right? The same way you'd have a two training session for data analytics, it's the same way you'd have for GRC or project management. All you need to understand is you need to be involved with the process. You need to ensure that you're not passive about it. Now, we know that a lot of us here 9 to 5, you're probably working already, or you are a student, you're doing your masters, you're doing something, you're busy, right? But the program is flexible in a way that you could also still adapt this into what you're trying to do. Because if you look at it, 4 months, 3 months, 4 months of your time to develop your technical skills and possibly land a job is worth it, even if you're employed. It's something that you can do while you are still on your job, and nobody needs to do. They'll just wake up to a resignation letter, and it's like you're not resigning to become jobless, you're resigning to start a new job, because on the cover you've been doing something. Okay, so that's literally the program. And we have a couple of success stories. We have people that have been able to gain so much from now. Success for our consultants is success for every other person like me on the team. And you don't even need to land a job, say it's a successful program or time with us. The mere fact that you feel more confident in your technical skills because of Amdari is success for us. The mere fact that you could come to a session like this and present, you present this insight in a way that makes the next person say, well done, you've done pretty well, this analysis was well reported. That's success for us. Because when a lot of interns, when I have clarity sessions with interns and they come to me, we not with interns, rather with people that are enthusiasts, and they come to me with certain requests, I'm like, you know where you want to get to, but you don't know how. Okay, you know that you need to do this, you need to do that, but you can't start because you still feel like it's not yet time, it's not the right time. Amdari squashes all of that. Is as you're learning on the job. Nobody is saying do 10,000 training before you start working on a project. Come work on this project. Learn as you are working. So that if you have an interview, you could literally pick up a project and use it to defend yourself, or use it to give an example of of how you were able to solve an actual real life project or problem, business problem, because that's literally what these are. So let's walk us through the success stories from Amdari. Okay, so we have Francis landed with Deloitte, and this was one of our success stories that just made us understand that we're doing something right. Okay, because if you're doing something, if you have a process and it's not working, trust me, you will not be able to get testimonials from it. People won't be able to attest to the fact that yes, this thing works. But because you start seeing results, you know that okay, these people actually know what they're doing. And he was one of those success stories that made us understand that what we're doing here is helping a lot of people, especially immigrants. Okay, now it's not easy to land a job, especially in the UK. If you're trying to land a serious job, you need experience, and this is exactly what we give to you. Okay, you don't need 2 years to start doing entry level jobs before you land. No, a few months working on the right kind of project can get you exactly what you're looking for. We have a couple of more success stories, and this is Dora. Dora landed a job as a compliance analyst in the UK. We also have someone like Lonre. He got a job as a business analyst in the UK. You can see how these screenshots are in their rawest form. We didn't do any editing of this. The only editing was just to remove that number so you guys will not stand harass his life, right? But this is in its raw form because we want you to see that this is exactly how these guys came to us to say, oh, I got the job, I'm super excited about it. That's how happy they are when they actually achieve exactly what they're looking for. We also have Faye Sayo. He got a job as a data scientist in the UK while he was working in the program. And that's the similarity with this. They did not need to wait until the end of the program to start landing jobs. They didn't need to wait until the end to start seeing results. They put in the work while they were on the program, and it's yielded results. Okay, so it's not like you come on to Amdari and we share jobs. No, it's not even possible. You need to play your part. All right, and we know the roadmap, we know the path. You just need to make sure that you are open-minded and you're following it the way we are, directing you to do so. Okay, I have a couple of hands raised. I'm going to take questions very soon. I'm not supposed to spend up to session done. We'll take questions, and from there we'll be able to call it a day. All right. So Damilola landed a job in the UK. What exactly did she do? She joined Amdari. She built a project portfolio. So we give you access to a portfolio website as an intern. Recently, I helped someone set up their portfolio website, and she literally just added her projects on there, so that when you're applying to jobs, you copy that list to go about job search. These things. It's only Amdari that would open your eyes to a lot of things. You could copy that link, add it to your CV, and apply to these jobs, so that when recruiters look at your CV, they could also go check out your projects. So your projects also speak volumes of the level of experience that you have. That's exactly what she did, and she was able to land a higher paying job by doing so. We have we have a lot of success stories, right? Now, this particular one, the bigger one, is from cybersecurity. That was his first cybersecurity job, and Christopher, his coach, letting his coach know that I got a job and it's my first. I would like on the job support. Amdari provides you with on the job support. So even if you land a job while on the program, and you still need us to hold your hands, because we still do that for you. Gladly, we will gladly do that. And I'm sure a lot of you have been hearing Emeka. So Emeka is one of our coaches, and this was one of his interns that got a job. What's so special about this particular intern? Jerry. He got a job from one of the projects he presented in a session like this. All he needed to do was make a few edits to that project, because the interview was kind of last minute. So that's what he used, and he was able to land a job with that. Now, for you to understand that a project that you're working on with us can help you to get a job. You know that you're not working on random projects, you're not working on anyhow projects, right? You're working on actual business problems that make recruiters want to have you on board. So you help them to solve the similar kind of problem, or they just want you to do something better because they've seen that you have the potential to actually help them. So that's exactly what was done here. Okay, so we have a couple of more. Vivian landed a job as a data scientist, working remotely in France, and this is also her reaching out to our founder Efemena, telling him about when he landed a job and requesting for a reference letter. Now, we have a quote starting tomorrow. I know if this is your first time joining us, it might be a rational or it might be a random decision you think you want to make right now. But I'll tell you for a fact that you think you have time, but there is literally no time. Uh, I work with, aside from Amdari, I work with a firm that we also apply to jobs and all of that. So we understand that this period is hiring season. My clients are getting interviews, and I can tell you for a fact that it's one thing for you to have an interview or an opportunity, and another thing for you to actually have the kind of experience that gets you hired. So why don't you dedicate the next 3 to 4 months of your time gaining the kind of experience that makes recruiters take you seriously, so that by 2026 you're getting your better paychecks, you're landing a job, you're doing exactly what you want to do the way you want it. If you want it to be a remote job, you know for a fact that now you have flexibility of time. You have time to just stay at home, work, work in your pajamas. You're just doing what you need to do, enjoying what you're doing, and having fulfillment from it. So this course that's starting tomorrow is something that I wouldn't want a lot of you to sleep on, because the next cohort is for November and you can't wait until November. November, December is obli, everyone is in the club, everyone is trying to have fun and all of that. So why don't you start now to build something relevant for yourself? Now, this is the course that's starting, and you can get in this night because we have a 24-hour window before it closes and time is already ticking. Okay, so I'm going to show us the financial commitment to get into this, then I would ask question. Francis says, I beg to leave now. Thank you for the work you do. Bye. All right, Francis, thank you so much for always showing up to our meetings. It's very, I am usually looking forward to have you on the call. Thank you so much. All right, now this is what it takes to come on board with Amdari. um the full amount is 500 pounds. Everything I have said since we started this session by 8:30 is 390 pounds at the moment. It's literally something that we on under promise and over deliver, because we know exactly what we want to get and how we want to help you. Okay, so 390 pounds is what it takes to get access to all of this, to work on this project. And when you land a job, the job you would probably get would pay you more than the amount you took to gain the kind of experience to get that job. All right. Now, if you can't make a one-off payment of 390 pounds and you want to start tomorrow, you can break it into 3 installments. Okay. So make your decision, make up your mind on this call. Your first installment is 130. Come on board. Let's get started with you. Then in the next month, you follow up with another payment of 130, and the final month you follow up with your final payment of 130 pounds, and you're done with your payments. Okay, so it's very um interesting payment plan. And instead of a 3 months of the way we are running it right now, you are getting an extra month free for the price of 390 pounds. What are you getting? You have Amdari on your CV. You would have actual accountability. You have projects on your portfolio, and you would also have access to a couple of extra things like the project portfolio website, um, job board, and also the I'll show you all of that. Okay, so this is literally what it takes, and these are the career paths that we focus on. I'm going to be taking questions now before I show us any other thing. So this is question time. I would start from the chat, then would proceed into taking the people's hands that I raised. Okay. So let me start from the chat to answer questions. If you also have more questions, please do well to drop it in the chat, or you raise your hand. Let's have a conversation. I love having conversations rather than chat conversations, right? So could you kindly touch? Okay, no, I don't know if that's question. Okay, I think I answered. Just curious to know how the GRC project internships are. just everything I have mentioned, in addition to the fact that it's GRC, it works almost the same way. Okay, so I'm going to let me see. You all will be using Google Google Classroom for all your activities, and you'd also have communications on WhatsApp with your fellow interns, consultants rather. So I'm going to show you all what the classroom looks like, and I'll show you just one GRC project, so you get to see a sample of something that you're going to be working with. Okay, so my colleague is going to drop the payment link in the chat for those of you that are serious about starting your tech journey, or not starting rather, or making an impact and doing better in your tech journey. If you're trying to get on board with the program, please use the link in the chat to secure your slot, and we are going to be so excited to have you on board. So I'm going to share my screen, and you'd see how the classrooms look like. Let me see. Let me quickly do that. So I go ahead with the next question. Okay. I mentioned that you'll be working with the Google Classroom. So this is where you get to, your project to be assigned to you here. Let me see. The project will be assigned to you on the Google Classroom, and also, if even if you miss a session, everything is recorded with Andari. Everything is recorded and everything will be uploaded here. So let me show you guys project material. Let me see. Okay, so let me show you what's a sample of this project. I'm just going to read you through the business problem and what they were trying to achieve for this project. Payments, page security, and preventing e-skimming guidance. Yeah, okay, GRC. Document changes. Let me see. Content. So this is literally a material for this particular project, and I want to go to business problem. Okay, I'm not sure I'm supposed to be showing you guys this particular material. Let me show you guys the project brief. I don't want to show you guys confidential details, please. Okay, let me see. Um, okay, let's look at another project. Okay. So you've seen here that everything is uploaded, literally. Everything is literally uploaded. Let me check. I think it's taking time to load. Or we can as well just look at the other project. I don't know why it's taking me so much time to load it. Okay. Case study activities. Okay, so this is a fintech project. Let me show you guys. The full case studies has it's a lot of material in there, but I'm going to show you the overview. This is a fintech, this in the fintech industry, and I want to look at the business problem here. So that business challenge. Okay, NovaPay's core challenge emerged from the very agility that in success in recent rapid. So this is literally a sample of what they worked on. Okay, and I'm pretty sure it's going to be around, some people were complying to some of the terms, regulations, and all of that, and also operational disruption and resource strain, delayed detection, reputational damage, and customer trust. So these were like obstacles and business problems. And this is the best part about all our projects. Every project solves a business problem. You're not working randomly. So this kind of document here contains everything you need to know about a project and what you would be doing for that project. So this is literally what let's see the deliverables. These are the deliverables for this project. It means that you're going to solve every single thing that is here and you're working on it. After every project, you do a project presentation. So what was the tech stack that was used here? For log management and analysis, they use Greylog. Okay, they use Greylog, and for data flow and architecture mapping, they use Lucid Charts, formerly known as Draw.io. Yeah. So these are like, there are more texts that they use, like Google Sheets, Microsoft Teams, Microsoft Word, OpenVans, and all of that. These are like technologies that were used for this project. So that's literally a sample of it, a project that has been worked on for GRC. And I can't go into more details when it comes to GRC. There are a lot of you know, data. I don't want to breach any kind of data or whatever. So I wouldn't want to go in so much details with that. But that's literally a sample and also the kind of how it works when it comes to this project. Okay, so I'm going to be taking more questions in the chat. And I see, could you kindly touch on data engineering project, especially in the context of a cross-functional team? All right, that's a very interesting question. So when it comes to cross-functionality of project, it's not all your projects. I mean, it's the projects are not entirely cross-functional for every one of them. Okay, so you might have some of cross-functional projects, but typically, especially for a career path like data engineering, you'll be working on specific projects within the data engineering, you and your teammates working on those projects. All right. So I can't exactly say how many would be cross-functional, but just understand that whatever you need to know as a data engineer in terms of your technical skills and um your soft skills, you are going to learn by working on those projects. But I can't tell you if it's going to be cross-functional or not, but you should just understand that you're still going to gain the kind of experience that you're looking to gain within the program. So that's it. Please, are we going to use any GRC tools? If yes, which one? Yes, you're going to use GRC tools. GRC tools will be used. Yes, I can't. Okay, let me just. I think I shared some of them when I was presenting this project, but for every tool you're going to be working with, it's your coach that gives you access. And also, if it's a paid tool, if it's a tool that requires you to use like a work email or whatever it is, all those resources will be shared by your team lead and your coach. They'll be the ones to give you the materials that you need, and the tool training sessions would be what would support you to be able to use those tools. So yes, that's exactly what we do. And the tools, yes, you would actually work with GRC tools. What time is the class? Which days of the week do people who work presently? Like I mentioned, the direct work experience internship is mostly we most people in the program that have 9 to 5s, people that are working remotely, people that are busy people. So the way it works, it's not a training, it's an internship. It's you coming to gain experience. So once you're assigned to a project with your teammates, you have what we call drop-in sessions. Now these drop-in sessions are like check-ins to see where you guys are with a particular project. It could happen 2 times in a week, 3 times in a week. On a personal level, you have to dedicate your own time to this project because you have your deliverable you need to deliver on a project. So you need to be able to give at least 2 hours of your time to it. Okay. So that when you're coming back to talk about your, to have your drop-in session, you'll be able to have what to say because you've done the work. All right. So it's not a training, so we don't have to gather all of you to do some kind of every kind of training. No, you just have a couple of sessions, and whatever time will be communicated with you, it's going to be a time that works for everyone. We are very conscious when it comes to that. Okay. So do I have any more questions? Okay, I'm going to take hands now, and I'm going to start with Ben. Ben hand was raised first. Then I'll take Elizabeth. All right. So Ben, you can go ahead, unmute yourself. Let's have a conversation. All right. Okay. I think Ben should be. All right, that's great. Thank you so much. Hi, Elizabeth. You can go ahead and ask your question. All right, you're welcome. So for every other person trying to get on board with the program, the link, the payment link is in the chat. It's tomorrow is the start date, so you might want to secure your slot to get started as soon as you can. So Elizabeth, you can go ahead so we can.
Okay.
Well,
Hi, good evening, everyone.
hi, good evening,
Good evening,
Elizabeth.
everyone. Can you hear me?
Yeah, clearly.
Okay, so my question is, you said there would be like you guys are gonna work on our series and the likes. Are you going to do that in the process of us doing the internship, or we have to complete the internship before you guys start working on the CV and the portfolios and the likes? Because you cited an example that some people were opportune to get a job even before they complete their internship. So is it like you guys have already worked on their CVs for them to be able to land the job, or they had to finish the internship before getting the job? If you understand what I'm trying to say.
Question. They got the job while they were on the program. We do not wait until you're done with the internship to start working on all of these things. You're doing it while you're in the program. All right. It's every there's literally a documentation to all these things so you understand where you are and at what point in time. So after a project, that's after your first project or your second project or so, after the first month, you would start revamping your CV. Why it's done that way is because by that time we can add that project to your CV and also add your experience with Amdari. So you could start using that to apply to jobs. We also encourage you to start applying from the second month of your program because at least your CV has been revamped, your LinkedIn has been revamped, so you can start applying to jobs, at least 5 jobs in a day. We encourage you to apply to at least 5. So we also give you access to the job board, and Diary has a job website where you could also apply to these jobs. And the rest of all of these are free actually. So you're not making any extra payments for it, the portfolio website and also the job board. So I'm going to show you what
Okay.
the portfolio website looks like. You don't need to pay for all of that. It happens while you're on the program. So that you I mean, if we wait until you're done, you might get tired, right? So it's while you're on the program, all of that happens, including
Okay.
the prep sessions. Yes.
Okay. Do you guys also help with jobs that comes with sponsorship and likes?
Help. When you say help, do you
No,
mean
like
like
you said there's a job board. So those
okay?
job board, are there
Yeah.
jobs that comes with
So
sponsorship there?
it's it's literally an integration we just recently started working on when it comes to that aspect because it's something that has also been in demand. So for the job board, now we are trying to integrate a section where you could also apply to, you could see here visa sponsorship jobs. You could also apply to that. So this is something that we are also trying to integrate into this. So this is the job board, and majority of the jobs here are well picked and also well um fitting into whatever career path that Andari focuses on. So it's an integration that at least in a week we should be done with this. Okay. So that's something that is currently being processed. And for the portfolio, I'm going to show you what the
Thank you.
portfolio looks like. Yeah, you're welcome. This is what the project portfolio looks like. Um, okay, so this is like the back end of this website. Okay, so you could change your, you could, it's very, very easy. You don't need to code, you don't need to write any line of code. You just need to update your details. And this is what the front end looks like. The front end is literally, you could use it in black. For those of you that like black screen, you could use it in white. So it's loading. Now, this share button is where you could copy this link and add it to your CV. I don't know why it's taking so much time, but this is coming up. So you could share it on LinkedIn, share it on Facebook, share it on WhatsApp, whatever platform. Copy this link, add it on your CV. And even to set this website up is very, very easy. So yes, that's literally what we have. The Learn platform is also something that will help you because in that Learn platform, there are a lot of crash courses there. Now, it's not everybody that comes to Amdari with 100. I mean, if you came 100%, there's no need for Amdari anymore. Okay, so you could use the Learn platform to watch series of crash courses, selected crash courses, just to brush up on your knowledge. Okay, thank you. My question has been also landed from Derek. This question for me, or you're asking someone in that is. All right, Elizabeth, have I been able to answer all of your question for me? Kayode, was I able to? I'm not an intern, I'm not a consultant with Amdari. I'm here to get you on board with Amdari, okay? All right. So I believe that should answer your question. Okay. And you can unmute if you want to have a conversation with me too. Okay. All right, guys. So uh I think I've showed you all what we have. There is more if you're trying to come on board. So now my colleague is going to drop the parity link in the chat. So if you're trying to make a decision, and Monday might be too late because tomorrow is the start date. So if you're trying to get this might not even have been your first session with us. You've attended a couple of our sessions, and I can say that it's high time you already decided. So you don't need to wait till November to get started. Because even in November, you would, I mean, November, December, you're going to the village, you're trying to come back to Nigeria if you're in the UK. What time tomorrow? Okay, 24-hour window started today. So we're looking at around afternoon time tomorrow. I don't know which country you're in, but if you're in the UK, we're looking at afternoon time by tomorrow. So you might want to do that either this night or tomorrow morning. The link is in the chat for you to be able to secure your slot. If you need to speak to someone, Toby, I want you to quickly drop a contact of one of our support team. So for not even the clarity session, because clarity is still Monday, we would have a clarity session, but drop a contact of our support so that anybody that wants to make a call through to support this night, just mention that you were from this session and you're trying to make a decision. They'll be able to support you to do that. So she's quickly going to do that for us. Do we have any other questions for me? Does anyone have a question for me? Do you need me to? What time will the program start tomorrow? I think it's 8 p.m. for the onboarding session. It's an onboarding session. So the first session is an onboarding session whereby you get to find out who is your coach, who is your team lead, who are your teammates, just understanding how the program works, and also what to expect from everything, from all the whole program. So that's exactly it. I think it's around 8 p.m. Does anyone have any other questions for me? Do you need any more clarity? Let me see. All right. Yeah, you can go ahead. Will the onboarding session be recorded? For sure, it's going to be recorded. It's definitely going to be recorded. All right. I think someone raised their hand. Kwesi.
Yes. Good evening.
Yeah. Hi, Kwesi. Good
Yeah.
evening.
As you said earlier, the onboarding will start at 8 p.m. Is it that all the classes will be in the evening, or we have some in the morning sessions and some in the evening sessions? Because some of us we
Okay.
work and then we have to come back in the evening to probably do the work. So I'm asking.
Yeah. So the onboarding session is in the evening. Some of your, I don't want to use classes, not a training, okay, but most of the time it might be in the evening because you, like you mentioned, you're coming back from work, you're tired, you're busy, you be more. Now for us to even pick a time, we need to check in to see if it works with majority of people, it works with everyone. Won't be available for that time. It's going to be recorded, and you could also reach back to if you are not able to meet up on time, so that they give you some kind of overview of what you missed and also give you some kind of support after you've watched the recording. Does that make sense to you?
Yeah. Good.
All right then. Thank you so much. Does any other person have a question? We are about coming to the end of the program, and I wouldn't want anyone to leave here with any more questions. So the support number is in the chat, so you can reach out to her this evening and try to get, if you need any more clarity, because if you're booking a clarity session, that's till Monday, and I'm telling you that's like you join the November cohort. But if you want to join the October cohort that is starting tomorrow and you're trying to secure your slot, you still need a little more confirmation, because I know we have very skeptical people and it's understandable for you to be skeptical. So you could reach out to her and she'll be able to support you with securing your slot and making your payment. So does any other person have a question before I call it in? Because we're already coming to the end of this meeting, and I mentioned that 9:30 is not going to meet us here. So do we have any questions? Do you need any more clarity? Do I go ahead? All right. I believe I've been able to answer everyone's question. So I'm still going to give you time. Even if you want to screenshot the number, you want to copy it, you could do that. If you want to book a clarity session,